KwaZulu-Natal Premier Willies Mchunu has been admitted to a Pietermaritzburg hospital. Mchunu collapsed while delivering the State of the Province address.
Reports say the 71-year-old has been unwell for some time. On several occasions, he's taken leave from work due to ill health. This morning, members of the legislature and other officials came to his rescue as he struggled to stay on his feet in the middle of the speech. He was rushed to hospital by ambulance. Economic Development MEC Sihle Zikalala continued the speech.
Well, for more on this story, we cross now to a press briefing around the Premier's health.
Has since improved. As he left the house, he was walking on his own. He has since been rushed to hospital nearby where we are, where he is receiving medical treatment. The doctors are monitoring the Premier's condition and on the ongoing basis, and the public will be kept abreast. As the ANC, we also would like to indicate to the media and the public that we've had a telephone discussion with the Premier, who's very stable at the hospital, who might give, depending on the time at which he completes the exercises he's undergoing with the doctors, return back to have lunch with all of us here before he departs for his house. So his condition is quite well. He's very jovial. I had a long discussion with him on his phone, and he's just waiting for the medical doctors to clear him up and permit him to exit the hospital so that he can briefly join us before going to his house. And therefore would like to thank all emergency medical services staff who responded speedily to this unforeseen development, and all those who prayed and also rallied around the Premier during what obviously became an hour of difficulty and an hour where he needed the support the most. Lastly, we wish the Premier all the best with his recovery, and we're quite certain that in no time, even before we leave here, the Premier will be back on his feet and proceeding with the important task of leading the government and the people of KwaZulu-Natal. Thank you very much.
Thank you very much, Comrade Nopala. That is the statement of the ANC, and like we indicated, we have the leader of government business who's a deployee of the ANC and the chief whip of the African National Congress. We can take hands. I know that there are a few colleagues that I stopped earlier on who wanted some questions responded to. So I will start with Hans if your question has not been responded to. I stopped you right in the middle of your question in the morning. Do we have any other hands, colleagues? Okay, Hans?
No, thanks for recognizing me. The question has collapsed.
Been responded. So it was necessary for me to stop you then. All right, do we have any other question?
I'm looking after.
Oh, on assessment. Yeah. Okay. Stan, you can talk to me.
Not for now.
Yeah, fine. Chief? No. Covered. Yeah, covered.
Premier unaye yini lapha esibhedlela uhamba naye uPremier na.
Okay. Well, I think I can respond to that. It doesn't necessarily need unobhala. When uPremier walked out, spousal Umamuzo also left with the Premier, so they are together at the hospital, and when they come, I think they will come together for lunch, then immediately go home, because we do believe that uPremier is needing some rest as well.
Yeah, but I think on that note we must always emphasize media engagement in government and in the ANC is coordinated. If there is a need to engage with the Premier, the office of the Premier is there. Mr. Msomi is always available. He will be able to tell you as and when you can engage with him.
All right, Seba.
Mr. Commander, as the ANC leadership, would you be advising the Premier to take a break on his government activities?
Well, you see, the condition of the Premier will always be best understood by the medical practitioners. It is not our call as the ANC to determine at what point and at which time should any member of the ANC deployed in government should take a break. The Premier is now being seen by the doctors who are quite certain that those are capable doctors who are equal to the task of determining whether or not he should be given a few days off, or he should come back and proceed with his responsibilities. The ANC will not get into that space because that is a space that requires a medical guidance and medical advice.
Okay. I think we have noted everyone. Thank you very much. Leader of Government Business needs to go and join. No, we'll do SABC now.
So a media briefing in KwaZulu-Natal taking place there after Premier Willies Mchunu could not continue his State of the Province address earlier on. SABC News was focusing on him as he started to speak. He looked like he was unwell. He complained about feeling unwell and then moved backwards and surrounded by people, escorted off and taken to the hospital. What we're hearing from that briefing is that although he's been hospitalized, he's expected to come out of that hospitalization very soon. They seem to be trying to say that although there was a scare, he is healthy, he is back on his feet, and he will be back on his feet and trying to do work very soon. We will be following that story and keeping you updated. Let's continue our bulletin now.